This is Dr. P.S. Taneja, MD from Dehradun. Today I am talking about the hypertension. Basically, you know that क्या कहते हैं कि hypertension is what latest updates and by the WHO. Hypertension is a condition in which the force of the blood against the artery wall is too high. This is the main definition of the hypertension. Usually is defined as blood pressure is above 140/90 and considered severe if the pressure is 180 and 120 above. So I am talking about the latest updates of the WHO that year. As per the latest updates, 63% of the death in India are due to NCD, that is non-communicable diseases, in which hypertension is one of them. CVD, which affects 45% in 40 to 70 years age of groups, and blood pressure is among them is the CVDs. In India, the prevalence has also gone above 30 years to 38% in men and 32% in women, and 29% in recently, respectively. WHO, despite that nearly half of the people or 51% of the men and 41% of women with hypertensions were unaware of the conditions. Over 62% of men and 53% of the women living with hypertension did not get treatment. Medication was used to control pressures in fever than 1:5 men and 1:4 men worldwide. Indian Society Hypertension has recently said that the inclusion of optimal and essential treatments paradigm attempts to address the issue that in resource poor settings. The AHA-ACC had released a scientific statement in 2021 offering new guidance of management of stage 1 hypertension among the patients with low CVDs risk. The low risk adults are 10 years with stage 1 hypertension, which is among them blood pressure is 130/139 or 80/89. Management starts with non-pharmac therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider standing, then we have to go to the therapy. Acute respiratory distress syndrome is a potential condition involving lungs damage. And recently in COVID-19, studied that Journal of the American College of Cardiology that metoprolol can reduce lung inflammation and improve respiratory function in the people which gone through COVID-19. Lowering systolic blood pressures targets down to the 110 to less than 130 range does substantially reduce severe adverse events in the STEP randomized trial. With regards to the prognostic valve of ambulatory blood pressure, monitoring and nighttime blood pressure, the European guidelines that has told in about 218 or 220, the atrial hypertension recommended that the diagnosis of hypertension should only be dependent on office BP measurements, but out of office measurements such as home blood pressure monitoring, 24 hours and nighttime BP measurements. For every 20 to 10 milligram Hg increment of BP measurements at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Since July 18, products containing valsartan has been recalled worldwide. The reason in the detection of a known carcinogen, namely N-nitrosodimethylamine, that is NDMA, which can be found in candesartan, losartan, olmesartan, and valsartan. NDMA has classified WHO International Agency for Research on Cancers to the carcinogen in humans. The presence of NDMA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the high daily doses over 6 years. Valsartan recall accompanied by significant increases in the rate of emergency department visits plus 6%. So this is the latest I'm telling about the updates of hypertension, which is given by the WHO. Thank you very much. Goodbye.